I don't think you guys are getting it. Nursing started off as women doing volunteer work, specifically nuns or women that worked in the church. And what they would do is go and get people that were basically dying and, allow them to die with dignity and comfort, right? Offer them care, offer them shelter. And these are people that were dying of things like leprosy, TB, other diseases that couldn't be cured at that time. As medicine began to standardize and we see doctors moving out of people's homes into a specific setting, which eventually became the hospital and the healthcare system, nursing evolved as well, right? So you had the nuns going from doing like charity work, taking care of these people that would have likely died on the street, to getting more formalized training and skills to work in the healthcare system alongside doctors. And then it becomes, your licensed vocational nurse or your LPN, your licensed practical nurse. And then we see hospitals now starting their own nursing programs. And it goes on where four-year universities start their own nursing programs as well. And then you see the profession begin to advance where you can get a bachelor's degree in nursing, and you can now go all the way up to a terminal degree if you wanted to get a DNP or PhD. Now, why am I mentioning this? Because one thing you have to remember is not because something has always been means it will always exist. If we fail to maintain the standards within our own profession, it will begin to erode the trust that people have in us and our abilities and clinical knowledge and expertise. It will also begin to erode the argument that nurses will put forth as far as like compensation is concerned. Right? As far as advancement is concerned, as far as the validity or the extent to which we could put our degree and expertise to work. Does that make sense? Because let's think about it this way, right? This is the way that I look at it. Nurses are a part of the interdisciplinary team. And if you don't know what that means, it means in the healthcare setting, nurses work alongside MDs, DOs, PTs, PharmDs, people in, sonography, all these different healthcare and allied healthcare professions. I don't see this conversation going on in those realms, right? Why is it in nursing we're so stuck on the convenience and making things easier and just not being able to commit to say we need to have standardization inside of our profession as well as education? Why is it just us?